Miss Gunn. I've heard you're going to be discharged from the hospital today. I'm sure you're excited to go home and see your puppy.
Yes.
Over the course of your stay in the hospital, your official diagnosis was hypertension. So this is just a medical term, meaning you have high blood pressure. And this is a common condition in many people, so you're not alone in this. We're going to discuss it today, what it is, how you can help it, and make sure you don't have any questions before you leave here today. Does that sound good?
Yep.
Okay, so basically in your body, there's the system called the RAS system. And this is where your body senses when your blood pressure is dropping. So your liver, kidneys, lungs, and adrenal glands release different hormones and chemicals that will increase your blood pressure. However, yours is increasing your blood pressure too much. So this is causing these tiny things called blood vessels that are throughout your body to constrict or become smaller, making it hard for blood to get through your body since it has to go through such a small space. So we want to make sure that we get your blood pressure under control and we decrease it. If we don't, it could have some bad side effects on the rest of your body. Some of the things that could happen are heart failure, or you could have a stroke. But we're catching your blood pressure, your high blood pressure in the early stages so we can get it under control and prevent any of that from happening. So you might be curious as to why you got this disease, and the answer is that it could be from several reasons. I see that your family history has an extensive amount of high blood pressure and are smokers. So this is a common factor that promotes high blood pressure. Also, I see on your BMI chart that it puts you in the category of obesity, and this could be another factor that increases your chance of hypertension. And lastly, that I saw that you take a medication called buspirone, which is for anxiety and depression. Increased stress is another risk factor that increases your chance of having high blood pressure. So if you would like any suggestions of help losing weight, increasing your activity level, please let us know and we can get you in contact with some dietitians that would be happy to help you. Also, if you would like help with stress, we could also get you in contact with a psychiatrist to help you to decrease and deal with your stress. So it seems you've been prescribed losartan. So if you see this medication also called Cozar, just know that it's going to be the same thing. All medications have brand and generic names, but they're always going to be the same thing. So this is a type of medication known as an angiotensin receptor blocker, and it's also called ARBs for short. So I know that kind of sounds confusing, but we're going to break it down. So like we were talking about earlier, the RAS system, well, this medication will block the chemicals and hormones that form that go to your blood vessels and make them become smaller and raise your blood pressure. So what this medication will do is increase the size of your blood vessels, preventing them from getting smaller. So blood will have a much easier time flowing through your body, and it'll be easier on your heart. And it also helps to remove sodium and water from your body through your urine. So you might urinate a little more frequently, but this is good because it'll make it also easier on your heart, so it doesn't have to do as much work to remove it from your body. So there's some side effects of losartan that we want you to be aware of. Most are not very serious and usually happen within the first few weeks because your body is just adjusting to the medication. And some of these are like cold, stuffy nose, dizziness, diarrhea. A little more serious side effect is called angioedema, which is like swelling around your head and neck, and especially like at your lips. And this is curable. We just want to know if it does happen so we can make sure we switch you to another medication. Also, are you on any birth control medication now?
Yes.
Okay, I just wanted to be sure. So if you do decide to go off that medication, you do need to let us know that, because losartan's a medicine that you cannot give to pregnant women. So we just want to make sure that you will not be getting pregnant while on this medication. While you're taking the medication, there's a couple things I do want you to look out for. Do you know how to take your blood pressure, and do you have access to a blood pressure cuff?
Yes, ma'am.
Okay, so I do want you to measure your blood pressure at least once a day for a couple weeks, just to make sure that your blood pressure is coming down, and I want you to record that. So a good blood pressure is 120/80, and we want to see you get as close to this as possible. But I just also want to make sure that it doesn't lower your blood pressure too much, because that's also a problem, and that's called hypotension.
Okay.
I also want you to come in about a month so we can see your recorded blood pressure measurements, and I also want to take some labs on you then as well. And I want to monitor the function of your kidneys and your liver. And we just need to make sure that they're functioning well, because this type of blood pressure medication won't work in your body unless you have good liver and kidney function. And I would also love to connect you with one of our dietitians to talk about possibly starting a walking log and maybe a diet plan. And let me know if I can get that started for you, because this would really help your hypertension to decrease it. And if you do continue it for a while, then it could possibly get rid of your hypertension so you could go off the medication. All right, now that we've had a full lecture session, is there any questions you have for me?
I don't think so.
Okay, great. Now what will you be doing once a day for the next 2 weeks?
Taking my blood pressure.
Good job.